Good evening, everyone. Muy buenas noches a todos. My name is Miguel Centeno, and I'm the Vice President of Strategic Market Development for AETNA, and I'm so very pleased to be here with you this evening. I'm also very pleased that we're back again supporting AHE's critical mission. And George, I want to thank you and congratulate you on the great work that you do every day with this organization. So congratulations. You know, George is right. Times are definitely difficult. And in corporations, as in many other instances as well, we're forced to make difficult choices about who we can continue to support given the current economic climate. But it makes so much sense for us to continue to support AHE's mission because it fits in so well with our company's commitment to diversity. And what I want to do is I want to take just a few minutes to talk to you about that commitment that we have at AETNA to diversity. And it really starts with how we perceive it. You see, some people may see diversity as an obligation, as something that we need to do in order to comply with different rules and regulations. But that's not how we see it. We see diversity as an opportunity. As an opportunity not only to do the right thing, but also to better serve our customers. You see, we understand that the more diverse AETNA is internally among its employees, and by that I mean at all levels of the organization, the better equipped we will be to understand the needs and concerns of the diverse communities outside of AETNA. So when I tell you that we get it, I want you to understand where that's coming from. And what is most encouraging is that that commitment to diversity comes right from the very top of our organization. You see, we have the great fortune to be led by Ron Williams, our chairman and CEO, who is one of the few African-American CEOs of a Fortune 100 company. And Ron, on a consistent basis, talks to employees about that commitment to diversity, and it's reflected in so many different ways that we operate. So I invite all of you to take a few minutes, go online, and read through our 2008 Diversity Annual Report. You'll find it there in English, in Spanish, and in Chinese. And what you'll see there is how diversity is embedded in the core values of our company. Now that report is only available online because not only do we support diversity, but every chance that we get, we also like to support the environment as well. And so yes, I do very much encourage you to read that report. The other thing that we get from Ron Williams, besides his leadership on the issues of diversity, is his leadership in the whole discussion around healthcare reform. And in that way, all of us in this room will benefit. You see, Ron has met on a number of occasions with President Obama. He has testified before Congress on a number of occasions. And he has done that to make sure that healthcare reform, however it turns out to be, works for all communities. Not just some or others, but all communities. And so you're going to see a lot more of Ron Williams on your TV screens going forward because he has been receiving lots of requests for media interviews as a result of his leadership. So when you see him next time, you'll say, that's Ron Williams. And I knew that I would see him eventually because Miguel gave me a heads up. So in advance, I say, you're welcome. Now, the Hispanic community particularly has a lot at stake in this healthcare reform debate. Many of you, I am sure, know the statistics. Nearly 1 out of every 3 Hispanics in this country do not have access to health insurance. So if you're sitting down now, if you look to your left and you look to your right, 1 out of the 3 of you may not have health insurance. And what I want to talk to you about, just a couple of minutes, about some of the things that we have done to bring about healthier communities in this city. Now, one of the things, given that statistic that I just cited, is that we had to make sure that we did everything that we could to make health insurance affordable. Now, we know several things. We know most people access health insurance from their employers. We know that most employers in this town, as across the country, are small businesses. So we had to create a product that would make health care affordable for those small business owners so that they could in turn provide it to their employees and their families. And so what we did was that we collaborated with many of the providers that are in this room this evening. And I want the small business owners that are here to know about the partnership that we have had with many of our providers. The providers that we have in the New York City Community Plan entered into a partnership with us. You see, they know very well about the number of people that are uninsured. And so they entered into a partnership with us. They allowed us, for this specific plan, they allowed us to give them lower reimbursement rates, which we then were able to pass along to small business owners in the form of lower premiums. And I know, because I've seen them, I know that there are people in this room that are benefiting from the New York City Community Plan. And so I want to publicly thank those providers that have entered into that partnership with us to make healthcare affordable for this community. A couple of other points that I want to make. It's one thing to empower people with access to health insurance. But what then about the doctors that they will see later on? One of the things that we are committed to as a company is cultural competency training. We want to make sure that physicians have a solid understanding of those patients that are sitting across from them. That's going to allow them to provide better health care. And it's something that we practice internally. All of AETNA's medical directors, nurses, and other medical staff are required to take cultural competency courses within 90 days of hire. And they have to repeat that training every year. And what we're doing is increasingly providing that training to the providers in our network. So not only are we working to provide health insurance to more people, but we also want to make sure that the doctors that they see, once they have that health insurance, understand who they are and understand their unique needs. The last thing that I will mention is that I'm also very proud to say that as a company, we have combined solid business practices with solid corporate philanthropy. Since 2001, AETNA has provided over $25 million to different organizations that have as their goal increasing racial and ethnic equality and access to health care. We are very proud of that particular record, and we are going to continue to support organizations like that. So, ladies and gentlemen, let me leave you with this. We know that we're living in very difficult times. But I'll tell you, tough times do not endure. Tough people endure. And I know that I'm in a room full of very tough people. And you can rest assured that AETNA will continue to support your efforts to bring about healthier communities here in New York. Thank you very much.